Welcome to The Explainer! Today, we're diving into a pretty fascinating blend of science, artistry, and honestly, deep compassion over at the CIHSR Aesthetic, Medicine, and Cosmetic Surgery Center in Nagaland. We're going to pull back the curtain on how modern medicine actually approaches facial rejuvenation and reconstructive care. So if you've ever wondered what really goes on behind the doors of a world-class aesthetic clinic, you are definitely in the right place. Let's just jump right in.
I absolutely love this quote from the CIHR Patient Guide. It completely reframes how we tend to think about getting older. I mean, we so often view aging as this flaw we need to hide, right? Or erase. But what if we looked at it as a narrative? Your skin bears the marks of your life, your laughter, your stress, your experiences. Modern aesthetic medicine isn't about scrubbing that story away. It's literally just about giving you the tools to write a really vibrant, refreshed next chapter. It's about making sure the way you look on the outside actually matches the vitality you feel on the inside.
So here's our roadmap for today. We'll touch on the science of aging, look at Botox and non-surgical options, figure out when to consider surgery, discuss the minimalist philosophy, cover the Happy Smiles Cleft Care program, and then meet the experts. Basically, a journey from science to art to heart. All right, starting with part 1, the science of aging and the biological mechanics behind it. You know, what's really fascinating here is that looking at the science takes all the mystery and honestly the blame out of aging. It's just a completely normal biological process. Deep beneath the surface, your stem cells are getting exhausted. The collagen that keeps everything nice and firm, it's gradually breaking down. And on a microscopic level, these protective structures at the ends of your DNA called telomeres are slowly shortening year after year. Now sure, lifestyle factors like sun exposure, stress, smoking, they definitely hit the fast forward button on this process. But fundamentally, this is just biology doing its thing. So what does this actually look like when we look in the mirror? Well, as that collagen and volume deplete, we start noticing hollows in the cheeks, maybe under the eyes, the skin gets thinner, a bit drier, gravity kind of takes over, leading to jowling and sagging in the lower face, and of course, years of smiling and frowning etch deeper lines into our expressions. But hey, recognizing these signs isn't about being hypercritical of ourselves, it's really just about diagnosing the mechanics so you know which aesthetic solution actually makes sense. Which brings us nicely to Section 2, Botox and non-surgical options. This is all about the art of early intervention.
Okay, so when we talk about neuromodulators like Botox, there's this really common misconception that they just freeze your face into a block of ice. But in skilled hands, using internationally recognized brands, they just gently relax very specific muscles. We're talking about targeting vertical frown lines, smoothing out crow's feet, even sculpting the jawline or refining those tiny micro lines around the lips. Interestingly enough, it's also super effective for treating excessive sweating, also known as hyperhidrosis. It's basically an elegant, non-invasive way to walk in, walk out, and just look remarkably well rested.
But what happens when injectables just aren't cutting it anymore? That brings us to Section 3, and what CIHR calls the million-dollar question, when to consider surgery.
The absolutely crucial thing here is understanding your own unique timeline. If you're dealing with early to moderate aging, think dynamic wrinkles from facial movements, early texture changes, maybe slight volume loss, then non-surgical options are definitely your best friend. The downtime is practically zero. But you really need to consider surgery when you're facing significant excess skin, heavy gravitational sagging, major under-eye bags, or deep jowls, essentially things that a needle simply cannot lift. A surgical facelift, when done on the right candidate, is literally one of the most transformational procedures out there, giving you results that can last anywhere from 5 to 10 years.
Moving on to Section 4, the minimalist philosophy. Looking refreshed, not done. Look, nobody wants to walk out looking totally unnatural or like they've had really obvious work done. The experts at CIHSR operate on a strictly minimalist philosophy. Their entire approach is to enhance your natural features, not alter your core identity. They actually say the absolute best aesthetic results are the ones where nobody can quite put their finger on what changed. Your friends should just look at you and think you've been sleeping really well, or maybe just got back from a fantastic vacation. It's all about bridging that gap between the energy you feel inside and what you see in the reflection. Now, Section 5 marks a pretty profound shift in our explainer. This is the Happy Smiles Cleft Care program, the true heart of CIHSR. Take a look at this number, because it is staggering. 1 in every 700 live births across Northeast India is affected by a cleft lip or cleft palate. These kids face immediate, life-altering challenges with feeding, speech, and just general social acceptance. But the incredible news here?
A single surgery can change absolutely everything for them.
And this right here is where aesthetic and plastic surgery completely transcends cosmetics and becomes truly life-saving. CIHSR's Happy Smiles program is officially recognized by Smile Train NYC and India Smile Train. They provide fully sponsored cleft lip and palate surgeries to eligible kids in Nagaland and the surrounding regions, Assam, Arunachal Pradesh, even the Myanmar border. This means families don't have to bear the immense, often impossible burden of traveling to massive cities. World-class, mission-driven cleft care is available right there, close to home. It's just incredible.
Finally, Section 6. Meet the experts, the folks providing the expertise you can trust.
It is genuinely amazing to see this level of international pedigree right in Nagaland. You have Dr. Bonalotha, who brings training from Beverly Hills, Singapore, and Taipei, and is board certified by the American Academy of Aesthetic Medicine. And working right alongside him is Dr. Temsula Alinger, who has this incredibly unique role. She balances her specialized plastic surgery skills with directing the Smile Train project, focusing deeply on facial reconstruction and functional aesthetic surgery. They are operating right at that fascinating intersection of high-end artistry, medicine, and deep community impact.
Which leaves us with one final thought. Are you ready to write your next chapter? Whether it's just a subtle non-surgical refresh or a completely life-changing reconstructive procedure, the art of aging gracefully isn't about trying to stop time. It's about moving forward with confidence. We've seen how CIHSR blends the raw biological science of aging with a minimalist artistic touch and a deeply rooted commitment to their community. So, ask yourself, does your reflection match the vitality you feel inside? Thanks so much for joining me on this explainer, and keep learning.